continuing the series that you asked for. You wanted more subject matter experts. And we got that for you today. We have Dr. Rachel. She is a doctoral trained nurse practitioner. Say that 3 times. And she focuses on longevity and wellness health. I was so happy to come across her. I can't even take credit. She found us because she definitely focuses on a lot of the conversations that we've been having with frustration y'all have shared with your bodies. It has created a lot of insecurity, a lot of self doubt, a lot of why am I broken? What am I doing wrong? And so we're really grateful to have you with us today to help us understand what's going on, what we can do, and kind of where the battle lines are.
Thank you so much for having me. I'm thrilled to be here and eager to dive in.
Why don't you kind of let us know what is this category of medicine and how would someone know if they might be a good candidate for this?
Longevity medicine is a super trendy niche right now. And I think there's a reason for that because of what our population demographics look like and the number of people who are at an age where it has been real for them. They are living in an era where they had hoped it was going to be the golden era of retirement, where they could be traveling to Italy and Argentina and Alaska. And instead, they're traveling to their cardiologist and their orthopedist and their neurologist and their endocrinologist and their psychologist and Monday through Friday. And that's their schedule. And that is very disappointing for people who have worked so hard their whole life and even followed a lot of conventional advice about what it means to be healthy. So what we have is the population that's coming of age right behind them, the children of that generation watching their parents really struggle. And you know what we don't want, you and I and your listeners, we don't want that for ourselves.
Yeah.
We want to age robustly. And there have been some amazing voices in this sphere that many of your listeners have maybe listened to. Voices like Dr. Kira, Dr. Huberman, Dr. Gabrielle Lyon. And they're telling a different story about the aging process and how we can continue to have some agency as we age so that we are not necessarily getting more and more frail. Like the truth is for you and I and all of us, even if we do all of our best work and listen to all the right podcasts, take the right supplements, exercise the right way, eat perfectly, we are all going to come to the end of our life. Our bodies are only going to live so long and something's going to give out. We know what Americans die of. We've got the big four. It will be one of those, very likely, unless there's something tragic that happens before that brings us to an early end. So in longevity medicine, the metaphor I use is we just want to kick the can down the road. Like I might get diabetes, but let's put it off till I'm 88 or 92. Like let's not get that at 56, right? So that's longevity medicine. It's not about living to be 150. There are biohackers out there that talk about those kinds of things, but that is not within our grasp at this time. And that's not the work I'm doing with patients. Most of them, when I ask the question, how long do you want to live to be, have never been asked that question before. But what I really want them to imagine is what do they want the last 10 years of their life to look like? And if they look around at how it typically looks now, it's really just not pretty. So if we can do anything to make that different so that we live robustly, holding on to our independence and our mobility and our cognitive function so that we have some enjoyment and some quality of life for as many years as possible. That is a very long-winded answer to what is longevity medicine.
I was honestly hoping for a very long winded answer because it's not something I've heard a lot about. And I feel like I play in this arena a little more than the average person just because of my job. And also, I don't want people who might be driving or on their treadmill trying to Google and be like, what is longevity? Do I just eat a bunch of mushrooms? Like, what's going on? Like, I really, because I think that, especially in Western culture and in the US, we're very much a microwave society. We want things to be you do something, you get something, and it's instant. And I think that that's really very much how a lot of medicine and treatment has been presented to us. And so when I was trying to kind of wrap my head around, I'm like, well, what does she have you do? Are you suspended in satin straps and you stretch and you like, does it stretch your spine and your hamstring at the same time? Like I was trying to kind of wrap my mind around how you actually apply this modality and like what people do. How do patients participate with if someone's 50 and they're like, I want to die at 85. I want longevity medicine. How does that kind of start?
So it starts in a very similar way that your relationship with any medical provider starts, with a full assessment of where you are, what you're struggling with, what your labs say, what your body is telling us. There's a variety of tests that we do, and what your goals are. So it's going to vary a lot by the individual. Often when first come to me, they might be 48 or right around that menopausal transition. It might be the first time they've had a hint that they're slipping a bit, right? They have spent an entire lifetime managing household schedules, kid schedules, their career, running companies. Now they're also managing aging parents, and now they're starting to have something called brain fog. Now their sleep is becoming fragmented and they see their performance throughout the day declining. They see weight gain happening, especially around their midsection when nothing's changed about their nutrition or their exercise. They might be that person who's always tracked their macros. Like they know they did keto when keto was king and then they did the next thing, but they always have been on top of it. And what used to work is no longer working. That is incredibly frustrating and a little frightening. And they might not speak that fear out loud, but it's there and it's part of what's running through their mind when they're awake at 3 a.m. having a hot flash. And so how that individual engages is we're going to look at labs and we're going to do a full symptom inventory. We're going to do risk assessment in terms of what is their 10 and 30-year cardiovascular risk. These are based on algorithms that are standardized. Anybody can pull up those screening tools online. But we do that. We do nervous system testing. So what I want to determine is, what is your capacity currently? If you are somebody who's used to operating at this really high level and you feel like you're slipping, what's actually happening? What kind of load is on your nervous system all day long, and how can we begin to support you in those areas? So it is multifactorial work. I tend to think of various pillars that we have to evaluate and put in place to build a solid foundation. And none of this is esoteric or surprising. I don't play with things like peptides when we're just getting started. Peptides might come into the picture once I have somebody really solid, grounded in their nutrition. We've optimized some hormone, done some other work around sleep, stress management, nervous system regulation. If we still have further work to do, we might at that point begin to look at peptides. That's a whole different conversation. But we start with the basics, but basics that have to be reinterpreted for a body that is actually aging. What is changing in a woman's body during perimenopause that causes her cholesterol to go up when she hasn't changed anything about her diet? What's going on and what do we have to do differently? So I have monthly or twice monthly visits with my patients. We do a lot of coaching and we do very comprehensive lab analysis. We help them modify their nutritional strategies if needed. A lot of times that means you've probably heard it. We need more protein, but also it probably means we need more fiber, right? So it is nothing revolutionary when it comes to the tools that we're using. It's just how we're using those tools.
I like how you framed that because we've been talking a lot about intuition and trusting your gut. And a lot of women just know or they feel, but they go to their doctor and they say, I know or I feel, and are oftentimes kind of shoot away. And it's not until those I feels kind of become true problems. And, I think a lot of things that we really struggle with as females is being seen as dumb, stupid, or broken. I don't want to go to my doctor and say all this stuff. And he's like, oh, we got a broken one in here. Here we go. So I think that causes a lot of women to just really kind of keep quiet and keep keeping on because you still got the kids' schedules, you still got the dog eating a battery, you still got your husband to take care of, you still got all this. So kind of what would be a good kind of checklist for a woman if she's like, I feel I've got this and this, and my gut's telling me, and I kind of feel when you specifically when you use the term slipping, can you kind of narrate that a little bit so someone may see themselves in that story?
Absolutely. I think if we compiled a comprehensive list of the physical and emotional and psychological symptoms that women report during the menopausal transition. So, to clarify that language, menopause, the average age of menopause is 52. It is officially diagnosed only in retrospect. So, when you have gone 1 year without a period, we can look back and say that's menopause. But leading up to it, what starts to happen is hormonal irregularity, hormonal variability, hormonal chaos, to be precise. And the effects that women feel in their body when sometimes their ovaries release an egg and they have the predictable spike in estrogen and then the spike in progesterone that we're all used to having over our normal cycle years, that starts to go haywire. And so we have periods of time where there may be a great imbalance between estrogen and progesterone, periods of time where one is high when it's supposed to be low, or the opposite. So the effects in our body can be anything from, I already mentioned brain fog. We all know hot flashes and night sweats and weight gain, irritability, mood swings, new onset anxiety. That's a huge one. And I want to come back to that. So joint pain, tendinopathies. The number of women who are diagnosed with tennis elbow, frozen shoulder, or Achilles tendonitis for the first time in their mid 40s, like those numbers are high. We see cholesterol numbers start to rise when they've never been high previously. Period irregularity, that's a given with hormonal chaos if women are still having periods. Sometimes they don't have that as a marker, maybe because they had a hysterectomy early. Maybe they have an IUD for contraception, or maybe they had an ablation for heavy bleeding at one point. So they don't have the period as a signpost to them because that's an obvious sign when things start to get really wonky with your period. That's kind of like the wake up call. Oh, this must be hormonal. Without that signpost, we just start to wonder, like, women come to me, they may have been like world travelers for work, traveling very frequently, and now suddenly in their mid 40s during perimenopause, they have what appears to be new onset anxiety. They're afraid to get on an airplane. And that could be why the number one prescription for women during this age range is antidepressants, anti-anxiety medications. And it could be why women so often feel a little gaslit when they're in their doctor's office, because my patients report things to me that still kind of break my heart that women are getting this kind of experience, even though we're living through what I think is this renaissance era in menopause care. Like, everyone's talking about it. We all are a little bit better educated now than we were even 5 years ago. That's great. But women still have the experience of going into their primary care or their gynecologist, and they come out feeling gaslit because they hear things like, this is normal, which might be true from a physiologic aging standpoint. Those doctors see women going through menopause every day. Yep, it's normal. You're supposed to be going through the menopausal transition. Now, that's true. That is normal. But what is not being said and not being offered is there are very safe and effective things we can do to help you with this. You don't have to suffer through this phase of life, and it doesn't have to mean this inevitable decline that menopause signals for the female body. There is no equivalent in the male body. When ovaries stop functioning, estrogen declines fairly dramatically, not to zero, because our adrenals are still producing some. Some estrogen is stored in our fat cells, but we have this rapid decline in estrogen, and estrogen works in every part of our body. We have estrogen receptors in every organ and tissue in our body. So we feel it everywhere. That's why the symptom list is like 40 items long. Our skin changes. We have vaginal dryness. Our libido goes away. Things just don't work. We start to have relationship issues, maybe because we have all this anxiety and we're irritable and we have no libido. Like, things fall apart. So women deserve better solutions during this phase of life. They're not getting them.
And I can see why I say challenge loosely, a challenge for our current medical structure, because it does look at the woman 360. It looks at her mind, it looks at her body, it looks at her emotions. And there's not many doctor practices that do that. They're so specialized. I mean, we always tease like you wouldn't go to your podiatrist for a headache, but that could still be related. I mean, if you asked a reflexologist, they would tell you that was. So it's like there's just so many ways that I think women can feel like they just need to suck it up. And so I'm so glad to hear you talk about it and normalize it so that someone doesn't think, oh, okay, I'm not crazy. My body's not broken. I'm not the only one going through this. So if someone is kind of experiencing these things and wants to investigate kind of a solution, how do you work with your patients, both in various states where you practice, states where you don't? And then also, like, I'm a super scared of needles. As soon as you said blood work. So maybe if you want to just emotionally prepare people, this is what it looks like. This is kind of what a journey would feel like with us.
Sure. So I'm licensed in 6 states. I'm licensed in Florida, where I live and have my brick and mortar practice, but I do telehealth in 5 additional states. I'm licensed in Massachusetts, Iowa, Colorado, Arizona, and Alaska. So it's a nice mix, and that list is likely to continue to grow. But if you are someone who's living in a state where I'm not licensed, I work with patients more on a consultative basis. So those are conversations that we have, and goal setting, and sort of, looking at the big picture and talking to you about options that are available based on what is going on, that you can then go find local providers to help you deal with those specific concerns. So it's very high level work, and I think very helpful for women who are just trying to navigate it and maybe have had an experience of, yeah, feeling gaslit, for lack of a better word. They're not getting answers at their doctor's office. And listen, I really don't want to be so contrarian that I'm just anti modern healthcare, because I've worked in modern healthcare for most of my career. I've been employed as a certified nurse midwife in large obstetrical practices. And, when you're in the system and you have 24 patients on your list for the day, and you've got 15 minutes with each patient, and if they're new, you have half an hour, you are doing your very best within the barriers that are designed into the system. And the way insurance reimbursement works, you probably had this conversation with other people. If you come in and you're there for one specific reason, guess what? We get to talk about that today. You may have 5 other things on your worry list, but unfortunately, because of how insurance is billed and what they'll reimburse, we can actually only talk about 1 or maybe 2 things today, and then I'm going to have to schedule you back for another appointment. And that is so frustrating for patients who they just don't understand how the system works. And they're trying to get something from a system that's not designed to deliver that kind of care. If you're at your primary care provider, primary care doctors are gatekeepers. Ideally, they would be overseers. So they're not just turfing you off to one specialist, but they're helping to put all the pieces together to make sure that they fit and there's no overlap. And I think that sometimes that actually happens and sometimes not. Same is true if you're at your gynecologist appointment. They are expecting to refill your birth control and do your pap smear. And, heaven forbid you want to talk about hormones because you heard, like, do they cause cancer? Or wait, is that old news? And am I too old? And they're looking at their watch like, okay, we don't really have time for this. Let me do my best, right? So it's a little unfortunate, but what I've designed is a program that just opens up some breathing space. So we have time to talk about all of it, everything that's on your worry list. We're going to talk about it. We're going to put a plan in place. Because if we want to be proactive and age as proactively as possible, we have to look at the systems that are in play. We have to, as women especially, we have to make sure that we're holding on to muscle. Muscle is probably the biggest predictor of our long-term health. We can measure things like grip strength and predict whether you'll live independently in your 80s. Now that's shocking, but it makes sense, doesn't it? Like if you can't open a peanut butter jar at 48 and you're constantly handing it to your housemate or partner, are you going to be able to live independently and cook for yourself 20 years from now? That's not likely. And what does grip strength say about your core stability and the chance that you might fall and break a hip? It says something. So we measure body composition using medical grade body composition scales, and we track that in my patients over time. If they're here locally, they come into my office, and if they're in Anchorage, I send them to a local gym or facility that offers it, right? So we get it done and we track those things because I need to know that over the course of a year, we're holding steady rather than losing because losing is normal. Losing muscle is normal, especially if you're trying to lose weight. Yes, you're going to be losing muscle. You have to work even harder. So muscle is a big one. We want to know what's going on in terms of our cardiovascular disease risk. That's blood sugar. That's cholesterol, right? That is, what does our exercise look like? What does our sleep look like? What's our heart rate variability? So I do some wearables with my patients. I do sleep tracking with the Aura Ring, and I have them do a few months of wearing a continuous glucose monitor because I think that it gives us fascinating data that for most people, they've never seen. They've never seen what happens to their blood sugar when they just grab a couple of Pringles. Like it wasn't much versus having a couple of crackers with some cheese. Like very different blood sugar response when you have some protein and fat with carbohydrates. So that's a strategic learning tool that I use with my patients. And we talk about stress management and sleep a lot, especially for women in this age demographic. We are the epitome of burning the candle at both ends. We have so much on our plates. And we're just going to keep giving because that's what we do. We'll just keep going. And we have to understand what kind of a toll it's having, and we have to make a plan for, how to begin to take care of ourselves.
You talk about how there is a way to identify what the toll has been versus us just knowing that we're exhausted every day or knowing that things just don't feel right. That we can actually measure those and put words to them, which is always helpful. And then there's a path out. So, kind of for those that are listening, let's say if someone's 35, are they too young? If someone's 80, are they too old? Is there kind of a window for where this type of medicine works?
There's some famous quote that I'm going to butcher. Maybe you've heard it, but the best time to plant a tree is yesterday.
Oh,
And the
sure.
second best day is today. So, how soon do we start? I don't think there's an age that's too young to have these conversations, except the youngest patient that I work with, and I'm not doing longevity work with this patient, but the youngest patient I'm working with currently is 18 years old. And we're really focusing on cardiometabolic health and weight management. But I do bring up these concepts with my 18-year-old teenagers, and they're probably rolling their eyes, but I do talk about things like building a health foundation that's going to set you up so firmly that these are going to be issues you may not have to worry about when you're 40. I don't know if they care, but I at least introduce the concept, right? At 35, I think we're starting to care. At 35, it's starting to get a little harder for women and for men. At 35, that is when my male, like college athletes are like, what happened to my body? I have a dad bod. Because, as a college athlete, they're told to eat like 5,000 calories a day, whatever you want. And that, the high level of exercise goes away. They're still trying to make it to the gym a few days a week, but they're losing the battle in terms of weight gain and they're starting to see their blood pressure creep up. So I don't think 35 is too young. For it to be a conversation for women around hormones, some women are definitely having some hormone imbalance in their 30s. It's not unheard of. It's less common. The typical age range for perimenopause starts about 10 years before menopause. So if menopause happens on average at 52, by 42, it's likely that you're beginning to experience something. If you are somebody who's going to go into menopause at 45, at 35, you might be feeling something. That might make
It
sense.
really does. And I'm glad that you articulated how they diagnose backward.
Yeah.
Like which is always like I feel like most of our diagnoses come, before things, get to that place. So I just wondered if someone was maybe got on late or what was driving, give us just kind of a recap of where folks can find you online, and then because we do have a global audience, just kind of where and how they can work with you. And And I just wanted to reiterate the way I heard it was don't be embarrassed. Like, no matter if you're, don't feel like you have to be 52 or older to reach out. If you're not feeling right with yourself, if you're feeling like something's a little off, completely feel welcome to reach out and kind of start the conversation with you at least to see kind of where we are. And if we need to do something, great. If we don't, I mean, if we need to do something, we can. If we don't, great.
Absolutely. And yes, I'm be thrilled to hear from anyone in your audience. You can find me on LinkedIn or Instagram. That's probably where I'm most active. Rachel Smith, DNP. I'm also on Substack more recently, so not a lot happening there, but that's growing. I'm also working on a book which will be out later this year. So stay tuned for that. It's going to be, the answer for women navigating their perimenopausal years. So I'm super excited about that project.
I love that. We were just chatting the other day about how when we were teenagers, we would get the magazine 17 magazine and we would wait for it to come in the mail. And sometimes one girlfriend would get it a day before the other one. And it was this race to read about it. And it's like, girl, we'd call on our clear phones with the colored, inside. Girl, did you read the article about your vagina? Do you know it has pH in it? And did you read that? I mean, it was like mind blowing concepts. And then it was like, you need to pee after sex. What? Where? Who said? It was just like we had been given just this holy grail of information. It was then kind of led to the conversation. Why is there no 65 magazine? Why is there no magazine that
Yeah.
talks about, kind of our bodies at this age? So I'm just so grateful that there's folks like you that are really embracing just that knowledge base and bringing it all together. And, having the little quiz, your boyfriend may not like you if, like you, I feel like yours may be like, your sleep cycle may be off if, and you're kind of going through that. So I really do appreciate it. And we'll put all this in the show notes, all of her contacts. So if y'all are driving, you're not trying to, write it down. But we were so grateful to have her connect with us because it really is putting a nice bow on our intuition conversations, our conversations around trusting yourself. If something's not feeling right, it doesn't feel right. And that you are empowered to push through. If one doctor dismisses you, you have the power to go to another one. You don't have to just go, okay, well, one said I'm fine. And then next thing you know, I mean, we heard so many of those stories. Next thing you know, the person's, got stage 4 this or advanced that or whatever. So I was really glad to have you talk about that. Is there anything you want to leave our audience with today, Dr. Rachel?
Well, first, thank you so much for having me. It's been a lot of fun. I'm super passionate about helping people build a foundation of health, not for the sake of health itself. None of us go around bragging about our cholesterol numbers or, our body composition, our muscle mass. But what we do is we use that health foundation to plan amazing adventures so that you and I can spend our golden years traveling the world, scuba diving, spending time with our grandkids if that's how we want to do it, but it's a launching pad for every amazing thing that we get to experience, and that is absolutely why I do this work.
We appreciate you, and you are definitely a pioneer. And I always applaud women who are brave enough to go first. And so that's kind of where you are in our community. So thank you so much. As I said, we'll drop everything in the show notes so y'all can find her. But thanks for tuning in today.